Hello everyone, this is a video regarding one of the global health disparities topic, which is the focus of the HBB March research program. We have attached a list of potential topics in your first assignment, but that list primarily serves as inspiration to deciding your final research topic. We would love for you to choose something that you are passionate and interested in and adapt it to your own context. Now, we will only be creating videos on around 3 topics, and you will be required to watch at least one of them and write a few sentences about it as part of your first assignment. And the point of this is to help you learn about some of these issues, and it may even lead you to discovering a potential research topic. So this presentation will be about language barriers in healthcare and how this leads to essentially harming patients. So this was made by one of our amazing volunteers at the HBB Resource Creation team as part of our volunteering program, and they've spent a lot of time and dedication into creating these amazing presentations, so we just want to take a moment to acknowledge their work. Now, how do language barriers harm patients? Well, language barriers has gained attention recently because of the detrimental effects it can have on patients. And these are often patients who don't know how to explain their pain or their disorder because of the different languages. And this can also be because of different cultural backgrounds or because of different dialects. So, what can these language barriers lead to? First, it can lead to a lot of misunderstandings. Google Translate is often not able to get the exact translation of what the patient wants to tell the doctor. This can lead to a lot of misunderstandings when it comes to pain. For example, when the patient is talking about a sharp pain, but the doctor thinks that it's a sore. Now, these are things that can be treated very differently, and it can essentially lead to a misunderstanding in the treatment and the symptoms aspect. Second, lack of empathy. There can be a lot of lack of empathy that can come into play when the nurse or the doctor is struggling to understand the patient. So the patient can start to feel like they are not being taken seriously because there's not really that kind of clicking sense of understanding each other when it comes to talking about their pain. And third, error or safety concerns. So these concerns can be a result of when there's a misunderstanding of when talking to the patient, and it can essentially make the patient lose trust in the doctor who is helping them. So, what is LEP? This is called Limited English Proficiency, and in the US, 8% of the population, and the population is aged 5 or older in age, has limited English proficiency, LEP. And this pie chart shows that the languages spoken by those with LEP, which means that English is not their primary language. In fact, the data shows on the pie chart that the primary language is 81.6% who know Spanish, 9% know Chinese, 3% know Vietnamese, and 2% know Arabic, and an unspecified percentage knowing Tagalog. Now, we can see how so much of the US, 8% of the population essentially, does not speak English or has a limited English vocabulary. So it's really important to acknowledge this when we're talking about the language barriers in healthcare. Now, let's start looking about how some of the healthcare workers deal with these language barriers. So since nurses are often the first point of contact for these patients, how they address the language barriers between the patient very often influences the patient's experience and their health outcomes that they receive when they go for their visit. So first, how do they recognize these barriers? Nurses can recognize these language barriers from a patient who nods, however, they fail to follow basic instructions. And they can also find out by looking for any signs of confusion or just accents and dialects in general. And what can they do to help? One way they can do this is by using a professional interpreter, which is a very effective form. And a lot of these healthcare facilities use over the phone or video conferencing to first find out the diagnosis of the patient. And these professional interpreters don't only understand the language, but they're also skilled in medical terminology, cultural nuances, and confidentiality. So this is very effective in breaking the language barrier between the patient and the doctor. Now, let's talk about misdiagnosis and mistreatment because of these language barriers. So language barriers in Saudi hospitals are caused by the linguistic diversity among these doctors and patients. And these barriers can very often lead to misdiagnosis or mistreatment. Studies have also found that healthcare workers use unofficial interpreters, which can lead to a breach in the confidentiality of the patient's diagnosis or symptoms. It can also be technology such as apps that translate any language. Now, these are great for protecting the privacy of the patient, but unfortunately, these efforts are very limited because they cannot get the exact translation and they very often get the symptoms wrong, which results in the misdiagnosis of these patients. So these apps can prove to be very ineffective when communicating. Now, research shows that ignoring social factors can actually lead to harming the patient. For instance, when physicians only focus on the biological without even considering the language, it can really increase the risk of communication and misdiagnosis. If they are only viewing the surface level without really communicating with the patient and understanding, oh, what's the deeper level of their pain, this can lead to a lot of complications within the treatment process. So what can be done to fix these language barriers? Well, first of all, we can have a lot of things, and Google Translate is not going to be an effective solution because it doesn't always get the translation right. But if this is the only option, you can use this. Now also, learning a few essential phrases can be very helpful in making the patient feel more comfortable around the health workers and health professionals. And lastly, which is the most effective way, is to invest in a professional interpreter. And this is going to be very crucial to overcoming these language barriers because they know the cultural nuances and the different dialects. So this can be very helpful to avoiding any misdiagnosis or mistreatments. So in conclusion, language barriers are very hard to overcome, but with the right resources and services, we can overcome them. Language barriers is very complicated. It's not simple, and it can even lead to misdiagnosis and mistreatment. So it's really essential that we take the effort to advocate and raise awareness for these language barriers and let people know that this is something that we should be taking seriously. So here are the sources for this presentation, and thank you for watching. If you watch this video, and you will be asked a few questions on your first assignment and you'll be required to fill them out, so please do that. Thank you so much for watching.